If you're planning on becoming pregnant, you should be taking folic acid supplementation at least a month before you become pregnant. And the reason for this is because folic acid is very much important for the development of the baby and for maintenance of the health of the pregnant mother. Folic acid deficiency has been linked to what we call neural tube defects because folic acid is necessary for the formation of the brain and spinal cord of a developing baby. If a woman is folic acid deficient, then the baby could have what we call anencephaly and spinal bifida or neural tube defects. Essentially, the closure of the coverings of the brain and spinal cord may be delayed, and you might see a child being born with part of their brain or spinal cord outside, like a bulge on the back of the head or top of the head or on the spine, along the spine. Folic acid is also important for the growth of the baby. So if a woman is folic acid deficient, then her baby might be small, so the baby might have a low birth weight. And when the baby's growth is being monitored in the womb, the baby might be small, so we'll call that small for gestational age. Folic acid is important for the formation of blood. So if a woman is folic acid deficient, the mother, that's herself, a pregnant woman, might be anemic, and her baby might also be prone to developing anemia right from being in the womb. Folic acid is important for formation of the placenta as much as the baby. So if the placenta is not well developed, there's also a likelihood that the baby would be small. So it's very important that a woman who is pregnant takes folic acid. And now the question is, how much folic acid does a pregnant woman need to take? Usually we advise at least 400 micrograms, which is 0.4 milligram of folic acid every day. Most people will take this in Premacare, for their pregnancy. But it's very important to note that there are certain women that will need to take a much higher dose of folic acid, up to 5,000 microgram, which is 5 milligram of folic acid every day. Now, if a woman has a body mass index of 30 or above, which means if she's obese on the big side, she needs to be on 5 milligram of folic acid a day. If she's had a baby in her previous pregnancy and the baby had a neural tube defect, she needs to be taking 5 milligram. If there's a close family history of neural tube defects, maybe her husband's family or her family line of a baby with a neural tube defect like anencephaly or spinal bifida, she should be on a higher dose. If she's taking anticonvulsant or anti-epileptic medications, she should be on a higher dose. If she has sickle cell disease or thalassemia, then she should also be taking 5 milligram of folic acid. Usually, a woman will have to be on folic acid for the first 12 weeks, that is the first 3 months of pregnancy. But if she has sickle cell disease or thalassemia, or if there are any other conditions that her midwife or obstetrician has advised that she needs to be on folic acid for much longer, then she will need to be on folic acid for the entire duration of her pregnancy to ensure her well-being and the well-being of her baby. Folic acid supplementation is not 100% protective. So you might hear some women say that they took folic acid in their pregnancy or even before becoming pregnant, and unfortunately still had children with birth defects like spinal bifida. It can still happen, but folic acid supplementation significantly reduces that risk by ensuring that the brain and spinal cord of the baby are well developed. I hope this video has been helpful. Share this video with anyone who you think will benefit from it, because a recent study showed that 1 in 4 Canadian women are not aware of the importance of folic acid supplementation in pregnancy. Thanks for watching.